Hi everyone, this is my presentation on gout. So first we're going to look at the outline, and this is going to cover the history of gout, what is gout exactly, who can get it, complications, treatments and prevention of gout. So starting with a bit of history, Egyptians first identified podagra in 2640 BC. And podagra is an acute flare-up of gout, and it affects the first metatarsal phalangeal joint, causing severe pain and inflammation. Podagra can be split into two parts, pod meaning foot and agra meaning cedar. In the 5th century BC, Hippocrates called podagra the unwalkable disease and arthritis of the rich. In the 1st century AD, extract from Colchium autumnale was used in ancient Greece. It's also known as the autumn crocus. The corm and the seeds are analgesic and without algos meaning pain, anti-rheumatic, anti against rheuma bodily humour or flow, cathartic from cathesis meaning cleansing or purging, and emetic from emetikos or aiming meaning to vomit. So also in the 1st century AD, Galen first described tophi and recognised they could be hereditary. And tophi are nodular masses containing monosodium urate crystals, which are white and firm. They cause pain and swelling and may be prone to infections in the skin surrounding the tophus. Masses typically appear on the ears, fingers, or elbows, and tophus means loose porous stones. Also in the 1st century AD, Seneca observed that women could also develop podagra. It was previously thought that men were only afflicted with gout. In the 2nd century AD, Aretius recognised podagra could also be inherited. It was previously thought it was only related to lifestyle. In the 6th century, Colchium autumnale was used specifically and selectively against podagra. It was known as colchicine. In the 13th century AD, the term gout was first used by Randolphus of Bocking, who worked as a chaplain for the Bishop of Chichester. In 1679, Antony van Leeuwenhoek, one of the pioneers of microscopy, first described the microscopic crystals from gouty tophi. And he said that he observed a solid matter to which his eyes resembled chalk, and saw to his great astonishment that he was mistaken. It consisted of nothing but long, transparent little particles, many pointed at both ends, about 4 axes of the globules in length. He couldn't describe better than supposing that we saw in the naked eye pieces from horsetail cut to the length of 1/6 of an inch. In 1763, about 100 years later, Van Stoeck rediscovered colchicine for use in gout patients. It was previously forgotten as it was banned for being too toxic in patients. In 1776, Scheele, a Swedish chemist, identified the structure of uric acid, and about 15 years later, Wollaston, an English chemist, identified crystals in tophi or uric acid. In the 19th century, uricosuric agents were first used, and these increased the excretion of uric acid in urine. In the 20th century, gout was, for some reason, became socially desirable. In the London Times, they said, a common cold is well named, but gout seems instantly to raise the patient's social status. And in 1964, Punch said, in keeping with the spirits of the more democratic times, gout is becoming less upper class and is now open to all. It is ridiculous that a man should be barred from enjoying gout because he went to the wrong school. In 1931, Garrett suggested that inborn errors in metabolism could be responsible for gout, and about 35 years later, a specific purine enzyme deficiency was associated with a rare type of inherited gout. So this is the purine metabolism pathway. As you can see at the bottom here, xanthine is catalyzed into producing uric acid, and that's done by xanthine oxidase. So what is gout? Gout comes from the Latin gutta, meaning to drop. It was thought to be the cause of an imbalance of the humours, with the excess of one humour dropping into the joint, causing pain and inflammation. So signs and symptoms of gout: southern arthralgia, especially at night, arthron meaning joint and algia meaning pain. Polyarthralgia, poly refers to pain in multiple joints, and this often happens later on in gout. There's also swelling and tenderness around the affected part of the joint, which is also known as arthritis, and itis, the suffix meaning inflammation. The inflamed parts are warm, red and purple and shiny, which may be itchy and peel away, and patients may find it hard to move the affected joint. Patients themselves may have malaise, mal meaning bad in French, and pyrexia. They can have a fever, which is per, phi, and pyrexis, also meaning fever. They may also have hyperuricemia, which doctors may find when they take a blood sample. Hyper meaning above, uric referring to uric acid, anemia referring to blood. So Thomas Sydenham had gout himself, and he described it as being a quite painful process. He was also considered to be the English Hippocrates. He said that the patient goes to bed and sleeps quietly until about 2 in the morning, when he is awakened by a pain which usually seizes the great toe, but sometimes the heel, the calf of the leg, or the ankle. The pain resembles that of a dislocated bone, and this is immediately succeeded by chillness, shivering, and slight fever. The pain, which is mild at the beginning, grows gradually more violent every hour, so exquisitely painful as not to endure the weight of the clothes, nor the shaking of the room from a person walking briskly therein. Gout is the result of urate deposits in joints. This is usually due to hyperuricemia, but isn't always. Uric acid is from urine or uric, which refers to urine itself. Uric acid can accumulate due to the deficiency or malfunction of xanthine oxidase, which we spoke about earlier, and this catalyzes the final stage of the purine metabolism pathway of xanthine to uric acid. Xanthos is Greek for yellow, and xanthine oxidase has a yellow-white appearance, or xanthine, sorry. Crystals form as uric acid aggregates at lower temperatures, and so these crystals are more likely to form in the fingers and toes as a result. So who's likely to get gout? It's often men between the ages of 30 and 60 years, but women can also get it post-menopause. And menopause, the etymology of it, men meaning month and pausing meaning to stop. People who take diuretics can become dehydrated, and this can increase the chances of crystals forming. So diuretics, dia meaning through, and uron meaning urine. People with hypercholesteremia will have raised inflammatory markers, and for similar reasons, so will people who are overweight. This may be due to something called endotoxemia. People who drink alcohol can increase their inflammatory markers too, especially with beer, which contains yeast and can increase the amount of purines in their blood. So complications of gout. They can cause damage to the joints chronically after many attacks, particularly after about 12 years, I think it is. Tophi can form, and so can kidney stones if the uric acid forms crystals within the kidneys themselves. So treatments, patients can do this themselves: raise and rest the affected joint and avoid vigorous activity or knocking it against something. Keep the joint cool and uncovered even at night, so don't let the duvet or the blanket touch the affected joint. Place ice on it to reduce the swelling. Give paracetamol to relieve the pain and ibuprofen to relieve the inflammation. So if this doesn't work, they can go back to their GP, who can prescribe stronger NSAIDs to ibuprofen, such as naproxen. This is given in acute gout to relieve the pain and inflammation. Proton pump inhibitors are also given with this to prevent the formation of peptic ulcers with NSAIDs. Colchicine can be given to stop urate crystal deposition in the joints. Steroid tablets such as prednisolone can be given if colchicine, the patient can't take colchicine, and as these steroids reduce inflammation. Cortisone can be injected into the joint, so intra-articular, intra meaning inside, and arthro again meaning joint, which reduces the inflammation. Allopurinol and febuxostat inhibit the enzyme xanthine oxidase. Allopurinol is preferred, but if patients can't tolerate this due to the side effects, febuxostat can be given instead. If neither of those is suitable, sulfonpyrazone or benzobromarone can be given, which increase uric acid excretion. So patients can alter their lifestyle to reduce the attacks of acute gout and also prevent them if they're at risk of getting gout. They can have regular exercise but not too vigorous, as this can cause an attack. They can lose weight safely to become a healthy weight with a healthy BMI. If they crash diet, this can lead to an acute gout attack. They can aim to drink less alcohol, particularly beer, and if they drink more water, they're less likely to become dehydrated, and so crystals are less likely to form. So for diet, they can aim for a low purine diet. So high purine foods include offals such as liver and kidney, game, rabbit or deer, oily fish, seafood, and yeast extracts such as Marmite, or even something like buying gravy ready-made from the shop. Moderate purine foods include meat, poultry, dried peas, beans, and legumes, mushrooms or mycoproteins such as corn products, asparagus, or whole grains. Low purine foods include dairy, eggs, bread, cereals, and pasta noodles, and fruit and vegetables. Some people also find that strawberries, oranges, tomatoes, and nuts can trigger symptoms of gout, although this is not understood. Patients are advised to also reduce the intake of processed food and drinks because this can exacerbate their symptoms. But they can increase their intake of vitamin C both through their diet and with supplements, as studies have shown that this can reduce the frequency of attacks. And for similar reasons, cherry juice can also be drunk. Hope you enjoyed my presentation. Thank you for listening. Goodbye.